Doctors and health experts across the country are reporting a spike in the numbers for a certain sexually transmitted disease, one that could be deadly.
KCBD News Channel 11 Sydney Lowther spoke to the City of Lubbock Health Department today about why we are seeing this increase both across the U.S. and here at home. Sydney?
Well, Karen and Abner, the City of Lubbock Health Department reported a 500% increase in cases of syphilis from 2019 to this year. And the frontline medication to treat the sexually transmitted infection cannot keep up with demand.
For a while, we really thought that we had eliminated syphilis.
Director of Public Health Catherine Wells says the city is seeing increasing cases of syphilis in all populations, but a 40% increase among women. She says most STD and STI cases rage among young adults, but they are diagnosing people up to 60 years old.
We would see, 50, 60, 70 cases a year of syphilis. Last year, for calendar year 2022, we saw 600 cases.
There is no definitive answer on why cases have spiked so high, but this increase has created an even bigger problem.
Increases in the number of syphilis cases and the number of people needing to be treated. We're also seeing a shortage in our frontline medication.
Pfizer is the sole supplier of penicillin G benzathine, the injection most efficient to treat syphilis, and it reported shortages in both adult and pediatric benzathine.
What we're having to do now is we're treating with the alternative medication recommended by the CDC, which is doxycycline.
Belle Maldonado is a licensed nurse who says receiving treatment as soon as possible is imperative, and doxycycline has proven to be a challenge.
The alternative medication you have to take for so long, so many days, and it's really easy once you start to feel better, you don't think you need those antibiotics anymore.
The penicillin injection is the only syphilis treatment safe to administer to pregnant women.
We are continuing to treat pregnant women and their partners with that bicillin, so we know that they're being treated adequately.
Syphilis left untreated can have detrimental damage to your internal organs, can lead to death, and can cause complications for women wanting to become pregnant.
And these things just continue to, wreak havoc in your body until you are treated, sufficiently for syphilis.
Pfizer estimates benzathine will not be easily accessible until April of 2024. So Maldonado says the best prevention of sexually transmitted infections and diseases is to use a condom. Karen and Abner.